like to just kind of go over a few things here. If you have any questions for the panelists, you can put them in the chat at any time throughout the entire session, and we'll do our best to get through them. If we don't get through them, we often can leave our email and we can get back in touch with you about it later. Try to remain muted. If you need to speak, you can raise your hand, your Zoom hand, and we can kind of call on you as a panelist, and you can unmute to ask your questions then. And this will happen during the breakout sessions only, so that's when it's going to be interactive. If you experience any technical difficulties or issues, you can use the chat feature, and there's many of us on here that can help you kind of try to resolve that. And I think that's pretty much, I think I covered all of them at that point. So this is a nice slide of everyone who's joining us. So I'd like to thank the residents who are joining us today to speak and to share about their experiences, their perspectives, and giving their advice. It's a pretty busy, time of year. And so we really appreciate your time. We also strongly encourage you to use the resources available at your school, particularly residency advisors. They're a great resource. So just to start to get this webinar kicked off for our first discussion, I'm going to ask each one of you to please share one crucial tip for effective preparation before clinical rotations. And if you don't mind sharing your name, your specialty, and the institution you're training at. And if we can start with Dr. Howerton.
Hey everyone, my name's Bree. I'm a PGY1 at Beaumont Health in Detroit. I am in emergency medicine and I'm really excited to be here today. In order to prepare for rotations, I think my number one recommendation would be most people don't expect you to have much more than your first and second year understanding, but in order for you to maximize your education, I did this with my rotations and really thought it was helpful. I created like kind of 2 to 3 attainable goals I thought that I could do during the rotation and shared it with my attending. And they really appreciated that I took the ownership, and I, as a resident now, really appreciate that I can help you because it's hard sometimes to know what exactly your weekend. And so it's helpful for us to be able to kind of guide your learning and see where you're headed. So that would be my recommendation.
Thank you. Dr. Corney.
Hi, everybody. I'm Migley. I'm Dr. Cornejo. I am a third-year psychiatry resident at George Washington University in DC. So one tip is, like logistics, like when you know what rotation to go on, like get your badge all set up, get your like login all set up. And this is important because so that like your first 3 days are not just like, what am I doing here? You can kind of just get the ball rolling. I always get impressed when my med students are ready, like I don't have to teach them the system because they already did it ahead of time. And then you can have more time for learning rather than just like learning how to log in.
Thank you. Dr. Eckert.
Hey everyone, I'm Harrison. I am a first-year family medicine resident at BB Healthcare in Lewis, Delaware. My tip is kind of more of like, I guess it's not like super specific, but it's important, I think, because no matter what specialty you think you might be going into, or like even if you're 100% set on something, just keep your mind open to every specialty, because even like for me, for example, like I knew that surgery was not for me, but there are so many skills that I took out of my surgery rotation in family medicine. So just kind of keeping an open mind to all of the things that you can learn and how you can tailor it to make you a better doctor.
Thank you for that. And then Dr. Narin.
Hi, my name is Tinzina. I'm a PGY3 internal medicine at UNC Health Southeastern. One of the tips for me that personally helped a lot, I get confused and lost a lot. So knowing where the parking lot is, knowing exactly what building, what room you would have to go through, what doors to go through, because sometimes it's very difficult as a medical student figuring out do I go through this entrance? What time am I showing up? Do I need to show up? So like planning accordingly, like giving yourself maybe like 30 minutes before. So if you do get lost, you're not, late.
Thank you. And I would just echo everything everyone has said thus far. I guess just treat it like any other job, show up on time, dress nice with whatever you have, it doesn't have to be a suit or anything, but just make sure you try to show up on time and honestly do your best. And I guess a weird kind of interesting tip I would like to share is like if you feel uncomfortable with something, say you're in a really long surgery and you're starting to feel really kind of sick or just like uncomfortable with it, don't feel embarrassed to kind of mention that. I think clinical rotations, it's new, it's totally different than when you're studying. And if something's not working well, they like when students, talk to them and try to just kind of be comfortable with them. So it's at first is gonna feel awkward. We all feel awkward in the beginning, learning how to like be a doctor, right? But just open communication will get you really far. Um, so I guess we'll go in the same order. Before we do the rigors, we have 4 total questions. So the second question would be, could you each highlight one common mistake to avoid during these clinical rotations for our panelists?
My common mistake is, especially in the last couple of years, we've had a lot of students asking to leave early. Like, I'm not saying you have to stay here forever, and I'm trying to get you out as soon as possible, but it looks really bad when it's like 11 o'clock and you're like, time to go, right? Like, no, not yet. So I would just say try to be patient and get the most out of your experience when you're there because yes, everyone's really busy and you have to study at home, but you can study there too. And just know that the longer or the more frequent you're asking us to leave, the less likely we're wanting to make you leave.
Okay, Dr. Conejo.
Okay, hi. So the one highlight or common mistake would be not reading. So every case you get, you should try to like read the literature about it, see if you can apply it to like practice questions, because seeing the patient in the case in real life is going to stick more than just kind of relying on practice questions. So having that like real life example is going to help with the testing later.
I would say that a mistake that I could think of right now is not getting the contact information of everyone that you work with. Because I know it seems like there's connections everywhere, so you never know what connections you're going to form, and even if it's something like a letter of recommendation or whatever, just always make sure that you're staying as well connected as you can, because the networking process will come up very quickly. So
Similar to what Dr. Eckert said, I think one of the common mistake is being super, like as a student, you're super quiet. You just want to, do your job, stay out of the way, and like go home. One of the biggest mistake was not communicating enough or treating each, I guess, like not faculty, resident, or fellows as like a friendly manner. So you can build that connection and ask for letters of recommendation, ask for help if you need it on like let's say acid base or something you don't understand. You could just, easily turn versus being like super strict.
Sorry. And sorry if you can hear my child in the background real quick. It'll just be short. He's just having a bad day. I would echo kind of the opposite of the positive of Dr. Howerton's. My thing would be acting like you don't like the rotation. It's more than just kind of I think you can, what I'm trying to say is attendings can kind of sense it through like nonverbal communication even. So even if you might find it the most boring rotation in the world, like say, I don't know, I don't want to pick on any one specialty, but say it's like neurology and you just find it so boring, just try to remember that your face like says a lot. And you'd be surprised how much they're like, gosh, I just don't think that medical student either cares but you might really care. It's just, weren't having a blast per se. So just try to, show the enthusiasm a little bit. All right. So the next question is, did you secure your audition rotations? Any tips to share, like how you secured those audition rotations?
These are a point I think of everybody's stress. And I will say that I auditioned primarily in surgery. So I started early, I started often, and I didn't have any problems getting into the like 10 auditions that I had. I didn't have any problems with that. Um, you start early though, and make sure that you're contacting people. I think as a second year or third year student, I thought that you needed to contact the program director. It's always the program coordinator. They are the left and right side of their brain. So I guess to answer the question is, how did I do it? I emailed predominantly. Most DO programs, you can just email them and then they'll take you. And then I also supplemented after that with Bizlo or the visiting service. It's maybe sometimes called something different now, but the VSLO is what I use to supplement.
For me, so I auditioned during COVID when everything went virtual. So a little different for me, but how I solidified my audition rotations was I was just like cold calling like programs, cold emailing programs, and then really sending like follow-up emails saying that I'm interested, things I liked about the program. And no, these places are getting multiple emails a day. So I was pretty assertive emailing these people. If I didn't get the program director, I'd get the program coordinator, or I'd get, I don't know, like the medical director. Like I got really creative.
Yeah, I'm gonna echo a lot of what the others said. Definitely the program coordinators are the best person, in my opinion, to reach out to. And always like look at the websites as well of the programs, because each program might have a little nuance that's different. Like they might have a Google form or something else that you need to fill out to like get your spot on the list. So always look into that. And then if you do the VSLO route, apply as early as possible, because I know some people like that for like other more competitive specialties had to literally like be up at midnight, and like by like 12:30 they were like done. So just keep an eye on the VSLO ones.
Similar to what Dr. Cornell had said, I also applied during COVID era. So I also did a lot of like cold calling, cold emailing, and I was trying to be more strategic, I guess, in a way when I did the audition rotation, because not a lot of places was accepting students. So I looked into location that I primarily wanted to be in, whether it was like East Coast, West Coast, or like wherever. And I looked into, I divided up into safety versus reach. If I was applying for residency there, would it be like a safety because I know like, I have the stats or whatever to perhaps get in, versus like, oh, I might not have it. Maybe I can like shine on my rotation. So that's how I planned mine, but mostly emailing and reaching out to, so I reached out to my school's, what is it called? The site coordinator and the deans to see if they had any connection with the places that I was trying to apply to. And if they did, they would shoot an email to the program director or the program coordinator. As everyone has said, they get a lot of emails. So having a little, friend in that route.
I did the exact same thing that everyone's already said. So I was before COVID as well. So at that time we were using the online system that Bree already spoke about. And then I also just emailed, but it was more so like Google searching kind of places I'd like to be, more like geographically, and then finding the programs and then emailing the coordinator. So I definitely agree with the coordinator part. Residency directors are really, really busy. They don't have a lot of time. Coordinators do everything. And when you interview, you'll see that they'll kind of coordinate literally everything, the interview, the hotel, all that. And so they'll have actually sometimes more information than the director. And it'll be easier to kind of get your foot in the door going through them. So I loved all those responses. I agree with all of them. The next question, moving right along, is how did you approach getting like letters of recommendation? And do you have any tips to share for the residency application?
For letters, so you only need like a maximum, I think, of 4 that you can apply to any individual application on ERAS. But I had 12 because I wanted to pick and choose programs where people were alumni and whatever. So every rotation that I had at the 2-week meeting mark where you talk about, how am I doing? Am I meeting your expectations? Is there something I need to work on? Whatever. I also brought up, hey, would you be interested or willing to write me a strong letter of recommendation? And at that time, we brought up, if an attending wanted me to approve myself in some capacity, I had 2 weeks to do it. If there was something that I was doing wrong, I had 2 weeks to fix it, and they could talk about the growth patterns and things like that. And then at the end of the rotation, I said, do you feel comfortable writing a strong letter of recommendation? And they would either say yes or no. I didn't have anyone tell me no, but I guess it could have happened. And then I said, okay, they're due in June, which is not true, but I set them a deadline so that they were plenty of time to be behind. And then I handed them a packet with my CV, my transcript, and like a 3 to 4 point bullet point thing of something that I wanted them to highlight so that my application was fairly uniform, which I thought was really helpful. They really appreciated it. And I had one that was late notice, I offered to like to write sort of like an outlet template, and then they would go in and change what they wanted from it. And that was also really helpful to be successful.
So I did something similar. Essentially with every rotation, I picked like 3 patients that really were memorable to me and learning points. And then I would just email it to myself. So then I like stored it in my brain later. And then when it came to residency, then I had that to reference, like, oh, I learned XYZ from this patient. And then at this point, you can kind of gauge like what attendings that you like that really like saw your work, and you can ask them. But then by that time, they probably like it's probably been rotation since they've seen you, but then you have that template up. So I even like went further and I made like the outline, and then they can edit it however they want. Because it takes a long time for turnover if they're just starting from 0. But then at least it's like I know the clinical cases that I did well in, and I know what I learned, and then kind of little reminders. And then if you're memorable and they like you, they're gonna know.
Yeah, I was thinking, I was like, I don't know what to say because I don't want to like be super repetitive because I just completely echo everything that they have said. But I guess the only other thing I would add is, in addition to always saying strong letter of rec, and then also like giving your like packet of info to like you're basically this is your outline. I would say just don't be afraid to ask for multiple, which I know was also said, but I know some specialties might have it a little bit different where you need a certain number from each place, but you can pick and choose which letters you want to send to each program you apply to. So if you kind of can pick and choose, I want them to see this letter because I think it's really well and shows this aspect of me, or it doesn't have to all be from the specialty that you came from. So.
I did very similar to what everyone else had said. I also created those orange color envelope with my name, my AMC ID number, the date I wanted. I also give them a fake deadline as well. I didn't do June, but I actually did July because I was trying to be nicer. And I gave them like the whole thing because I wasn't sure if they would, I don't know. So, and what I did, similar to what Dr. Cornejo had said, I also wrote down memorable cases and memorable encounters we had. So let's say a physician was like very much into like, uh, you know, taking into like a home environment of a patient when they're diagnosing, like, oh, do you have the support at home? Do you have this? So whenever the rotation was ending, I bought a stack of thank you card and I would write them a thank you card. And on the thank you card, I would mention all the cases we saw that was interesting and how much I like truly appreciated learning, why it would be such a great thing if they wrote me a letter because I appreciated X, Y, or Z from them. And I just always felt that people are more receptive to writing you something nice when they read something nice about themselves. So that's what I did. So I would say it, I would also say like it's strong. And if they agreed, then I would like hand them the packet with a thank you card, of course.
Yeah, everyone said all the things you should do. I didn't do like a set timeline to ask for my letters. I would wait to see if I got along with the attending to the point where I could feel comfortable asking for a letter. Not every clinical rotation will kind of, you guys won't always get along like buddies, for instance. And so sometimes you'll like, oh, maybe I'll wait till the next, rotation to ask that person. And so, a couple of them I felt close enough with them to ask them in person. Couple of them I emailed them because they were good at responding with email. So I felt comfortable doing that. And the last tip I would give that's a little bit different is if you ask someone and they agree, but they keep taking a very long time to write it for you, and it just doesn't look like they're ever going to do it, which sometimes happens, just try to maybe find someone new. It's not great, but it happens. And so if you can quickly think of someone who also would be a great person to represent you, don't feel, it's like Bree said, she had 12. You don't need 12, but if you had, if you only have to submit 4 and you had 5 or 6, it's nice to have that extra one just in case you're having a hard time getting that one to submit. So don't I maybe just ask, have a few more than normal if needed, just to make sure you have enough. And then the last question that we're going to ask is, how do you balance your busy rotation hours, because they're different than when you're a student? I guess you're still a student, but sitting in the classroom, and your shelf exams.
Yeah. How do you do that? I would say the first one is always hard. Give yourself some grace as you learn how to do X, Y, and Z. There are plenty of extremely successful human beings who failed 1, 2, 3, 5 shelf exams. I'm not saying you should. I'm just saying that you can still be successful and it happen. For me, I tried to do, my school gave us curriculum to accomplish throughout the rotation and had it broken down by day. And so I tried to have half of it done before I was off the rotation. So that meant during break times doing questions. That meant during lunch reading articles. When I had questions, I tried to talk to them. Also, I wanted to do the least amount of work at home as possible. So if I was on surgery and I was super busy there at the hospital 12 or 16 hours a day, I would tell my residents and attendings, like, hey, this week I'm studying trauma for my shelf. Ask me, teach me trauma things. That way we could both have a good question. We could have good contact, we could have good content. And when they pimped me about stuff, I had a focused attention as to what it could be about and if I was actually retaining stuff. So it was a good 2-for-1. I tried not to study at all when I was at home except on the weekends. And that was how I did it, was that I tried to take all my break times, I made them meaningful. And then I also told my attendings what to quiz me on and teach me about during the day.
So I went about it a little differently. I can't break up things. So I did all my studying in the morning. So I would just wake up really early. I actually did this in residency too, where I'd wake up at like 3, 4 a.m. and just like get like 3, 4 hours in whenever before I had to go into clinic. Because once I start like seeing patients, I feel like I'm like 100% there, and it's hard for me to go from seeing patients and like doing all this stuff to like sitting in front of a computer and studying. So I used up, it was like that was the first thing I did every morning, did it every day, and then I used up my weekends to study also. So that's how I went about it. I'm too tired at the end of the day. I cannot like I think I tricked myself into thinking I could do it. I can't do it. So I do it in the morning.
I would say so I'm kind of chaotic when it comes to studying. So like I don't usually like pick like morning or night. I kind of so probably not good advice from that standpoint. But in terms of when to study, I would say this is just what worked for me. The first week of my rotation, I hardly studied at all for my like COMAT exam. I just took that to get acclimated to the rotation and get set in, figure out what I was doing. And then the last 3 weeks is when I kind of started getting more into the studying. And then there's different study resources out there, and they work different for everyone. So kind of like I think it was Dr. Howerton was saying, like give yourself some grace in the beginning, because this is totally anecdotal. But for me, I found that ComQuest worked better than TrueLearn for me for shelf exams. But I know people that it's the total opposite. So you just kind of need to figure that out. I know some people use the key phrase analysis, KPAs, I think they were called. So just yeah, find what works for you.
Sorry, I didn't know I was like not muted. Sorry. Yeah, I agree with everything everyone said. What I did, I worked backward. So if I knew the date of my COMAT for my school, it was usually on a Friday, last Friday of the rotation, then I would just work backward. Like, okay, so I basically have like 3 weeks to get this. Then I would pick my resources. So I used mainly like online method and like ComQuest primarily. So I would divide up the video. Let's say pediatric had like X amount of video. I would divide it up. Then it had like, let's say 100 something question. I would divide it up. I divided in a way that I gave myself, I guess, like amount for each week, but also made sure that I at least had at least 2 to 3 days of like a wiggle time, because sometimes when you come from rotation, the hours could be longer and you get tired so easily. And sometimes you just feel burnt out, like you just like don't want to study. So I gave myself 2 to 3 wiggle days within the schedule I created. That way, even if I fell behind, I'm like, okay, it's okay. I have like the sore day to catch up. So on the last week, I was done with basically, the questions, I was done with the video. And the last week I didn't feel stressed, because that way I like knew like, what portion I could like focus on, like what they're doing incorrect or redoing the Q bank. So that's what worked for me.
All great answers. I think this is a difficult question. The transition from second to third year with studying is difficult. I mean, some rotations are long and you don't want to study, and residency is the exact same way. Unfortunately, it's not a negative thing. It's just an energy thing, like everyone's alluded to, when you're in your first 2 years, you get to kind of decide if you're going to go to class, if you have online options. You might get an exercise like a workout in or something. You might get to stay late and have coffee, and you kind of just beat to your own drum a little bit more. When you go to third and fourth year, you're very structured. Lots of time is taken away from you, and yet you're expected to know the same amount of information, put in the same amount of work, and there's just not the same amount of time, which is what all the panelists are alluding to. So I think the top like couple things I would say is get the resources that work for you. Is it online med-ed? Is it ComQuest? Is it, those little, can't remember what they were called, but there was like these little books that, you could get for each shelf. Are you a reader? Are you a video watcher? Just kind of make your time efficient, because your time is less. And then, if you have days where you're too tired to study, go to sleep. you know, you're not going to fail them likely if you study all the other days. I wouldn't say that the exams were outrageously difficult if you put the time in. I think that they were manageable. So missing one day here and there, you're going to be fine. The only one I thought was really, really hard was the OMT one. I don't think I could have studied enough for that one. It was very difficult. And so some of them catch you off guard like that, even if you did study the full month. So, and that's just how residency is as well. So you just have to try to be more efficient with your time. And I think that's like the best advice from my perspective. Other than that, you pick how you study kind of thing because everyone's different.